Hello everyone. Today's topic is the chapter 2 of Robbins: cell injury, cell adaptation, and cell death. This is a picture from Robbins. This depicts about the cellular response to the stress and toxic stimuli. So this is a normal cell where normal homeostasis is happening. So whenever a cell has to face this stress or any injury, then initially the cell undergoes adaptation, where the cell is allowed to survive and continue its function. But whenever this adaptation is failed, that is cell is not a the cell loses its ability to adapt, then cell will undergo injury. And the injury can be again of two types: reversible injury and irreversible injury. In reversible injury, the cell will return to its original state and its function, whereas irreversible injury, where cell cannot return to its original state, and this can be of two types: necrosis and apoptosis. This image tells about the relationship between an adaptation and cell injury. So whenever the cell undergoes adaptation, that is in response to any increased overload in case of hypertension, then the first cell will undergo adaptation. The adaptation is in the form of hypertrophy here. So the normal cell size is increased in the form of hypertrophy. So here also the left ventricular wall hypertrophy is seen. But if the cell cannot cope up with adaptation, that is after a certain point, even cell loses this adaptation capability, and then it leads to the cell injury. Here the reversible cell injury, in case of reversible cell injury, only gross changes can be seen. Microscopically almost always it is normal. So grossly, this area is an area of necrosis seen in the myocyte. So this is the pathogenesis of hypertrophy, where there is combined actions of these mechanical sensors, agonists, and growth factors. So this all of these leads to the activations of various signal transduction pathways, and these signaling pathways will activate the transcription factors. Here it is GATA4, NFAT, and MEF2, that is nuclear factor activated T, and MFE2 is myocardial enhancing factor 2. So all of these transcription factor leads to increased synthesis of proteins and growth factors, which finally leads to the increased mechanical performance, leading to the hypertrophy. So the hypertrophy can be of two types, that is it can be pathological hypertrophy and physiological hypertrophy. So pathological hypertrophy, examples for pathological hypertrophy is seen in striated muscles of the heart as well as skeletal muscles. So both these striated muscles of the heart and skeletal muscles have a limited capacity for cell divisions. So for any adaptation to occur, the cell cannot divide. So for that, obviously the cell should undergo hypertrophy. Example is, in case of heart, it can be because of hypertension or any valvular disease, but in case of skeletal muscles, hypertrophy is seen in bodybuilders. And stimulus for hypertrophy in both heart muscles as well as skeletal muscles is increased workload. So whenever there is an increased workload, the muscle cells will obviously respond by synthesizing more protein and increasing the myofilaments per cell. So this is a myocyte. So they will first of all synthesize more protein, and also increased myofilaments per cells are increased in case of hypertrophy. This in turn will, so because of increased myofilament within a cell, this now can increase the amount of force each myocyte can generate. Thereby it increases the strength and capacity of the muscle as a whole. So now it has an ability to respond to any metabolic demand. So physiological hypertrophy, The example for physiological hypertrophy is uterus during pregnancy. So in this during the pregnancy there is hypertrophy of the smooth muscles. So the hormone which is produced during the pregnancy, that is estrogen, the estrogen hormone will signal through the estrogen receptors, and eventually that results in increased synthesis of smooth muscle protein and thereby increase in size. So estrogen hormone seen in the pregnancy will increase the will result in increased synthesis of smooth muscle proteins and thereby increases the size. And the other examples is muscles of the bodybuilders. So this image is taken from the Robbins. This is an hypertrophied uterus, which is called as an gravid uterus of an pregnant female, whereas this is a normal uterus or the non-gravid uterus. This is a gross image for example for the hypertrophy, whereas these are the microscopic image. And here these are the small spindle shaped cells are these smooth muscle cells of the uterus, taken from the non-gravid uterus, whereas these plump spindle shaped cells, which are relatively bigger in size compared to this, these cells are seen these cells are take this section is taken from the gravid uterus, and both the magnifications are the same. Both of the magnifications are same, and the cells are smaller and spindle shaped here, whereas when the cell undergoes hypertrophy, the cells become plump, and size of the cell increases, which is called as an hypertrophy. The mechanism for hyperplasia. Hyperplasia can be because of growth factor derived, or it can be because of an stem cells. So growth factor derived proliferation of mature cells can happen, or the increased proliferation can be from the tissue stem cells. Example for this is after partial hepatectomy, this growth factor will engage the other receptors on the surviving cells, and that will in the and that will cause and that will activate the signaling pathways, which will cause a cell proliferation. But if this proliferative capacity is compromised, then what happens? If the proliferative capacity is compromised due to the hepatitis where cell injury happens, then the hepatocytes will proliferate from the intrahepatic stem cells. Physiological hyperplasia. So you should know all the examples of hyperplasia. Could be hypertrophy, hyperplasia, atrophy, or metaplasia. So they are usually asked in the NEET PG. The examples of hyperplasia could be like, they can ask in the form of what is the example of hyperplasia or what is not the example of hyperplasia. So you should know the examples of all. So coming to this physiological hyperplasia is seen in female breast at puberty and during pregnancy, whereas compensatory type of hyperplasia is seen after partial hepatectomy. That is, the individuals who have donated a lobe of the liver for transplantation, then the remaining cells will proliferate. So proliferate so that the organ will grow back to its original size. And in case of bone marrow, following acute bleeding and hemolysis, then this growth factor, that is erythropoietins, are activated, which will stimulate the progenitor red blood cells. So examples for pathological hyperplasia. It is pathological hyperplasia is caused by excessive or inappropriate actions of the hormones or the growth factors. So whenever there is an excessive or inappropriate actions of hormones and growth factors on the receptor, then it leads to an hyperplasia. Example is endometrial hyperplasia. So normally what happens? Normally after menstrual period, there is proliferative activity after menstrual period, when it starts the new cycle, so there is a proliferative activity by the pituitary hormones as well as estrogen. And after the proliferative activity, the secretory cycle will start, that is at 10th to the 14th day of cycle, and it is brought about by progesterone. But in pathological condition, such as in disturbed uterine bleeding, this balance is disturbed, resulting in increased estrogen, and that consequently leads to endometrial hyperplasia. The other example is BPH, that is benign prostatic hyperplasia. It is also an hormone induced hyperplasia of the prostate glands by androgens. And skin warts, viral infections such as papilloma virus leads to the skin wart. So whenever there is increased cell division, that is cells are whenever the cell is undergoing hyperplasia, so the cells are at a risk of developing genetic aberrations which can lead to the development of cancer. So the next is atrophy. Atrophy is reduction in the size of the organ or the tissue due to the decrease in the size as well as number of the cells. So the mechanism of atrophy, basically hypertrophy was due to increased protein synthesis, whereas atrophy is because of decreased protein synthesis as well as increased protein degradation in the cell. So what happens in the atrophy is this ubiquitin proteasome pathway is activated. There are free ubiquitins present in the body, and these ubiquitins will go and attach to the target proteins. So the ubiquitin will go and attach to the target protein, and this leads to the target protein is degraded in the proteasome finally. Okay, and this pathway is also seen wherever there is an accelerated proteolysis as well as increased catabolic functions, that is cancer cachexia. So examples of physiological atrophy during normal development, that is some of the embryonic structures, that is notochord and thyroglossal duct, will undergo atrophy during fetal development only. And the other example is uterus, that is the size of uterus decreases shortly after parturition. So the examples of pathologic atrophy, first one is disused atrophy seen in fractured bone. So following fracture due to immobilization or in a complete bedridden patient due to not usage of that particular leg or arm, then there is an atrophy of skeletal muscles occurs eventually, but this atrophy is reversible if activity is resumed shortly. But with more prolonged disuse, muscle fibers decrease in number as well as size, leading to atrophy. The second example is denervation atrophy. Denervation means absence of nerve supply. So normal metabolism and function of any skeletal muscles are dependent on its nerve supply. Whenever there is a damage to the nerve, then that leads to the atrophy of muscles supplied by that nerve. And diminished blood supply seen in brain of adult life, that is old age. So in case of arterial occlusive diseases, that is there is a gradual decrease in the blood supply, finally leading to the atrophy. Example is brain. So the brain undergoes atrophy due to the atherosclerosis developing in the old age, and it is called as a senile atrophy. The next example is inadequate nutrition. So the example for the inadequate nutrition is in marasmus. The marasmus pathogenesis is mainly the protein calorie malnutrition. So this protein calorie malnutrition is associated, initially there is depletion of this body reserves, that is adipose tissue. Later on when the adipose tissue reserve is lost, then body tries to eat the skeletal muscle protein only, leading to the atrophy, and this results in marked muscle wasting, which is also known as cachexia. Cachexia is also seen in the patients with chronic inflammatory condition and cancer. Overproduction of cytokines is seen in this chronic inflammation and cancer, that is mainly the tumor necrosis factor, and it is responsible, this TNF is responsible for suppression of this appetite as well as lipid depletion, leading to the muscle atrophy, and subsequently pathologically we see as an atrophy of the muscle. The next is loss of endocrine stimulation. Breast and reproductive organs are dependent on the endocrine stimulation for their normal function, but after a menopause where estrogen stimulation is lost, that results in the endometrial atrophy and atrophy of the vaginal epithelium. Pressure. Due to the pressure, atrophy can also occur, that is, tissue compression for a substantial amount of time can cause atrophy. Example, any enlarging tumor can cause atrophy of the surrounding tissue. This could be probably because of pressure on the supplying blood vessels where blood flow is compromised. The next is metaplasia. Metaplasia is a reversible change. Okay, it is not irreversible, it is reversible. It is asked many times in the NEET PG. So metaplasia is a reversible change in which one differentiated cell type is replaced by another cell type, which means the already differentiated cells could be columnar cells or squamous epithelial cells or any glandular epithelial cells. So the one differentiated cell type is replaced by another one differentiated cell type. It could be seen either in the epithelial cells or in the mesenchymal tissues. It is also asked in NEET PG. So this is an ciliated columnar epithelium which is replaced by this stratified squamous epithelium. Microscopically also these are the cilia and these are the columnar cells. So the ciliated columnar epithelium is replaced by the stratified squamous epithelium. So the examples of metaplasia are in case of cigarette smokers. So normally the trachea and bronchi are lined by ciliated columnar epithelium. But due to this chronic smoking, that is chronic irritation which is happening, this ciliated columnar epithelium is replaced by stratified squamous epithelial cells, which is more tougher and it is able to cope up with this irritation. And also in vitamin A deficiency, this vitamin A deficiency also induces squamous metaplasia in respiratory epithelium as well as in cornea. And also stones in the ducts, could be salivary duct or pancreatic or biliary duct. If there is a stone which is present in these duct, then due to the chronic irritation, the normal ducts which are lined by columnar epithelium, then this leads to the metaplasia, that is squamous metaplasia. So why does this metaplasia occur? This is because the more tougher, that is stratified squamous epithelium, is able to survive under stress circumstances. But this metaplasia is a double-edged sword. It comes with a pay. For example, in case of respiratory tract, the metaplasia is in the respiratory tract. Due to the metaplasia, the ciliated columnar to stratified epithelium lining becomes more durable, but the mechanism of ciliated columnar epithelium is protection against infection, mucus secretion, and ciliary action, which is lost. And if this trigger for metaplasia is still persistent, then it can initiate a malignant transformation. So, this metaplasia can lead to the development of squamous cell carcinoma. Example for metaplasia is, one of the example is Barrett's esophagus, where this Barrett's esophagus occurs in the esophagus. So in this esophageal squamous, the normal esophagus is lined by squamous epithelium. So this esophageal squamous epithelium is replaced by intestinal type of columnar epithelium. This is because of reflux of the gastric acid. So the patients having an Barrett's esophagus has an gastric acid reflux. So this gastric acid reflux chronic irritation leads to the replacement of squamous epithelium to the intestinal type of columnar epithelium, because intestinal columnar epithelium is able to tolerate the acid which is refluxing. So if this irritation persists, then cancer can develop in the Barrett's esophagus, which is called as an adenocarcinoma. And mesenchymal, as I said, this metaplasia can be seen in epithelium as well as mesenchymal tissue. So the mesenchymal tissue formation can also occur, such as cartilage, bone or adipose tissue can develop. Example for this is myositis ossificans, where bone formation occurs in the muscles following any trauma or irritation. The next is mechanism of metaplasia. So metaplasia is not just a change in the phenotype, but rather it is because of reprogramming of these stem cells, uh, where the stem cells present at the site are reprogrammed to differentiate into the other cell types. Okay, so the stem cells which are present at the site of irritations or the injury, then they are reprogrammed so that they are differentiated into the other cell type. Or it could be because of colonization of the differentiated cells from the surrounding cells which are already differentiated. Stimuli for this metaplasia are cytokines productions, growth factors or extracellular matrix. So in case of stem cell reprogramming, where these external stimuli, cytokines, growth factors and extracellular matrix, this will promote the cell towards the differentiated pathway, leading to the development of undifferentiated cells. Thank you for watching video. If you like the video, please let me know in the comments below. Thank you.